Hey guys, I'm Morgan here with Dentist Job Connect. I'm with the awesome Dr. Sonny Spera, who is in Upstate New York and owns, how many practices do you own?
We have 5 practices total.
5 practices in Upstate New York, and he is looking for a few associates to join him. So can you just tell us about what you're looking for and what, your opportunity for associate dentists and why they would want to work with you?
Okay. Well, I think they want to work with us because we're awesome. No.
I agree.
But, I think the opportunity is multifaceted. I think an ideal scenario would be if there were a couple of docs that wanted to join and also wanted to take some equity and some ownership positions, because my one partner is going to be transitioning out in about 3 years. My timetable, I don't really have it yet, but I think that could work for me, at least backing off a little bit. And I have a couple of other docs that may be doing the same. So we have 7 of us in total. Different doctors have little different ownership positions. But we've kind of created a really nice ecosystem. So we have our own lab. We have a good marketing person. We have a great management. And we treat everybody as a partner and an equal. So the input that we get from a couple of our younger docs that are in the practice is valuable and is so important to us modifying and working and changing. But getting back to the opportunity, it could be a great career for someone who maybe they have other interests or have family obligations and they want to be able to work 4 days a week. Perfect. If they can do 3 days a week, that'll work fine. If somebody wants to do 5, I'll probably try to discourage them a little bit, but I think, and the reason is because I think our practice is out of network.
Right.
So it's a fee-for-service practice. I think we're used to a certain culture and a certain commitment to the patient and the community. And I think it's very hard if you're not really all in, but I also think you want to be at your best. So I think once you get closer to 40 hours a week, you start to take a little wear and tear and maybe a little less patient with a certain situation. So our ideal scenario is 32 to 36 hours. Compensation, very competitive. We'll help cover your relocation costs and those kind of things. The signing bonus, we'll do all those things. But I think the main thing is our culture and the way that the vibes of the practices are, you're going to allow it to be yourself. And if you have an interest in implants, great. Our lab can help support you in that. If you have an interest in cosmetics, great, run with it. If you want to do some oral surgery or you want to get into periodontics or whatever little areas that really, ignite your inner fire, I think we have all the ability to do that. And with the flexibility, if you want to work in a different office, you can. If you want to stay in a home office, we've established that. Right now, most of our docs will work out of a couple of locations. Okay. So that's how it is. But I think in bringing some new folks in, we have the ability to just have your home base here, your home base here. And then when we get together collectively as a group, we get together and we talk about the greater, practice. And the greater good, basically.
That's awesome. And you talked a little bit about how you're there to support them and, expanding their skill set. So can you talk a little bit about the mentorship and what you expect when, the associates come in, what procedures you expect them to do? It's just bread and butter or whatever they're comfortable with and what they have the, kind of already touched about the opportunity they have to expand.
Yeah, I think the most important thing is who they are, right? I think it's got to just be, it's got to feel right. I'm a little more visceral, right? You kind of know when you talk to someone, like when someone meets you for the first time, they're like, hey, you've got a certain energy and vibe. I like that.
Yeah.
And so that's such an important thing, that first impression, et cetera. Now, getting back to some of the nitty gritty things, I think it's good to have a nice competent base in general dentistry. Doesn't mean you have to be doing 15 units or all on X, or I don't think you have to be doing that. But again, if you want to, we can help, facilitate the education and to the steps to doing that. But I think to have a really solid base in that you're competent, with emergency care, be able to handle patients who are new or in the area or coming in because they're in need and in pain, is just a tremendous service. And we do have a lot of same-day treatment and same-day dentistry. So to have that in your tool bag and your skill set, invaluable. Competent at diagnosis and And you call it bread and butter. I'm going to call it. That's fine. I'm going to call it basic dentistry, like your fillings, your crowns, that kind of stuff. If you're competent at endodontics, it's just a huge plus. Maybe you're not comfortable in the larger molar cases, but you want to be, great. Well, we'll help you get there. If you don't, well, that's okay too, but be competent at the handling of the emergency part, right? And just treating people like when they come in that they're your brother, your sister, your family member, and what would they want? Or, excuse me, what would you want for yourself, right?
Yeah.
So I think that's important. We don't have a minimum requirement like, oh, you have to be able to do this.
Yeah.
I think you have to be good and competent. The most important thing, I think, for us collectively is to have some continuity in our treatment planning. So we do spend a lot of time with all of our docs reviewing cases, x-rays, how did you treatment plan this, what did you see, and then learning from our, and I want to use it, but I'm going to use it, the F word, failures, learning from our failures, and then how do you improve on those things.
Awesome.
And what's really nice is we all share the burden. So if you've had a patient with a crown that's broken and they happen to come in and see me, I'm going to want to try to fix it for them, and vice versa.
Got it.
So it's a real team environment.
That's awesome. Well, thanks so much for sharing. I mean, I just met Dr. Spera in person, and he is incredible. And so I think any associate that gets the chance to at least just connect with you is lucky. So check out the opportunity listed on dentistjobconnect.com, and we hope we can find you the right associate.
Thank you. And if I can help anybody, even if it's not for us, I do that all the time with a lot of newer docs and help them if they're confused on a situation or different options. I've helped a lot of folks, and I just think it's imperative to help the next generation because someone reached down and helped me. So
that's awesome.
That's who we are.
Well, thank you so much.
Thank you.
Thank you.
Appreciate it.